Hi, my name is Helen Mejia, and today I'll be talking about some of the early stage symptoms that women go through with ovarian cancer. So, some of the early stage symptoms that women go through will include like bloating, urge to urinate, fatigue, or loss of appetite, and even lower abdomen pain. Some of the advanced symptoms that women experience with ovarian cancer would be like weight loss, unexpected back pain, pain with intercourse, major fluid collection, or even abnormal bleeding with the vagina. So, these early stage and advanced stage of ovarian cancer can be determined by three ways. These three ways include a pap smear, a clinical examination, or an imaging test. It is very important for females to pay attention to these signs and symptoms that they feel with their body because it can literally lead to cancer in the ovaries, which is very dangerous. It can cause death in like different women. Um, it's just very important for them to notice all these symptoms that are presented in their bodies. Thank you.
So, Ortega, and today I'll be talking about the etiology of ovarian cancer. Etiology refers to the set of causes in any disease. In this case, there's no clear cause for ovarian cancer, but it is known that it forms by a mutation that causes the cells to multiply quickly, creating the tumor. It is also known that it can spread throughout the body pretty quickly when it breaks off. Although there's no cause for the ovarian cancer, there's many risk components that can make you more likely to have it, like old age, inherited genes, endometriosis, and hormone therapy after menopause.
Hi, my name is Marina Aguilera, and I did the pathogenesis of ovarian cancer. So, before I start, I just wanted to give a brief definition of what pathogenesis is. And all it is just the development or the evolution of a disease, in this case, ovarian cancer. So, as of today, there is no pathogenesis of ovarian cancer that has been accepted by all medical practitioners around the globe. And this is something that's fairly common in the medical industry, just due to how rapidly things are growing. But I was able to find a couple of theories that were somewhat similar. A lot of them were just repetitive information, and some of them were distinctive in their own way. So I wanted to include some of the theories that I found that were more commonly shared or just had more reasonable theories behind them. So the first one I found was that ovarian cancer isn't just one disease alone, but it is multiple tumors that are composed together, and sometimes those tumors can be found to be distinctive due to their structure or their genetic features. I did see an example that said that if you were to go to a gynecologist and you were checked and you were to be found with these distinctive tumors, later down the road, you could be diagnosed with ovarian cancer. Another theory that I did find was that the disease originates from the ovarian surface epithelium, which is just a single layer of flat to cuboidal epithelial cells, which then can turn itself inside out into the underlying stroma. Underlying stroma or stroma is just cells and tissue composed together that give our organs their structure. Stroma is usually just composed of blood vessels, nerves, and connective tissue. So once it's turned itself inside out into the underlying stroma, it can then later result into an epidermal inclusion cyst. Most of the time, these cysts are benign, but there have been a couple of cases where they have been found to be cancerous, but it's very rare. Another theory that I found was that once the cancer is set in place, it then spreads from the ovary, then to the pelvis, then to the abdomen, and then to the distant organ, sorry. So, a couple of facts that I found about ovarian cancer was that give or take around 20,000 women in the US are just diagnosed with ovarian cancer each year. So, out of those 20,000 women, around 2,000 women have the disease passed down to them due to an inherited mutation of the BRCA1 and BRCA2 gene. just meaning the breast cancer gene in 1 and 2. Sometimes during surgery, the tissue that's holding the tumor in place can sometimes break or tear, and this can usually lead to a surgical spill, which just means the cancer then spreads to the pelvis or to the abdomen and then later into the distant organs. Determining the cancer stage once you are diagnosed has a huge impact on you and your doctor. Just this is a way for y'all to know what is the next step, what can you expect next, and what do you have to do in order to stop the growth or at least minimize the growth. So, due to there not being a known pathogenesis or a stable pathogenesis, there's nothing practitioners can do up to date in order to slow down the growth, maybe just doing chemotherapy or basic therapies in the medical industry. But due to there not being a known pathogenesis, there's nothing we can do now to stop the growth or to minimize the growth. Thank you for your time.
Hi, I am Jaylee Canales, and the part that I got assigned to do was treatments for ovarian cancer. There are 2 treatments for ovarian cancer: surgery and chemotherapy. What is chemotherapy? Chemotherapy is an anti-cancerous drug. What does chemotherapy do? Chemotherapy can have 3 outcomes. It can help extend life, remove cancer, or cure cancer. What is surgery? Surgery is a medical procedure done by surgeons and instruments to treat abnormal conditions. What does surgery do? Surgery can help remove or repair. Surgery for ovarian cancer is mainly used in stages 1 and 2. Surgery helps remove the cancerous tumor in the ovaries. If the cancer is more advanced, then the ovaries, fallopian tubes, womb, and cervix will be removed. If the cancer is super advanced, then you will have to do chemotherapy first, surgery, and then chemotherapy again. Chemotherapy for ovarian cancer is used in all stages. Chemotherapy in stages 3 and 4 is used first. There are 3 cycles, and then you go into surgery and then another 3 cycles. So there will be a total of 6 cycles of chemotherapy done. Chemotherapy helps interrupt cancerous growing cells for ovarian cancer.
Hello, my name is Jessica Ngall, and for this presentation about ovarian cancer, I have been given the role of researching prognosis. So, prognosis is the prediction of how likely a disease will develop. This can include the symptoms and signs and whether it will worsen or better over time. For ovarian cancer, this could be difficult to predict as it is usually diagnosed at a later stage. To be able to properly determine accurate prognosis in ovarian cancer, samples, diagnostic tests, and imaging scans are used to predict the longevity and its effectiveness. There are 4 stages to ovarian cancer, each with different prognosis. We have stage 1, stage 2, stage 3, and stage 4. So for stage 1, women in ovarian cancer have great prognosis, being diagnosed with only tumors. 15% of women diagnosed with ovarian cancer are in stage 1. They have a 5-year survival rate of over 90%. In stage 2, the cancer means that it has spread to one or both of the ovaries and/or areas of the pelvis. They only compromise 19% of diagnosis and have a 5-year survival rate of 70%. For stage 3 cancer, it has spread to not only the ovaries and areas of the pelvis, but it has spread to the abdomen and/or the lymph nodes. This compromises 60% of all cases of ovarian cancer with a 5-year survival rate of 39%. For stage 4, the cancer cells have spread past the abdomen and onto other parts of the body, possibly in the lungs or tissue of the liver, with a 5-year survival rate of 17%. Ovarian cancer is a dangerous cancer that can affect all women, and although its symptoms and effects can be scary, there are high chances of survival rates when diagnosed at an early stage. Thank you.
Hi, my name is Maria Jose Barragon, and our presentation was over ovarian cancer because it was only girls in our group project. As well, my mother was an ovarian cancer patient. At the time, we had no idea she had cancer. There was moments where she had early signs of cancer, although we ignored them and she ignored them completely. But there was a moment where the signs could not be passed by anymore. The signs were where she would have extreme abdominal pain, as well when she would use the restroom, when she would pee and also use the back, she would bleed. And these signs were advanced signs of cancer. She had started going to special doctors to treat herself. The first thing they had to do was surgery. This surgery was a long process, but this was just the beginning. They had to remove a big tumor that was growing inside herself. This tumor was big. It was stage 4. So when surgery was done, all she had to do was recover. After recovery, her next step was chemotherapy. Chemotherapy was meant to kill the cancer that was left behind. These processes aren't always 100% because they don't kill all the cells, and they're killing the cells, but at the same time, it's making the person weak and it's killing the good cells the person has within them. So yes, there was a point where chemotherapy was not helping my mother. Chemotherapy, there is an extension in which you are allowed to give a patient. Chemotherapy kills the good cells as well. So chemotherapy was out as an option for my mother. The next step was radiation. Radiation was a little bit less harsh on her body. Yet this wasn't working as well. Her second surgery came up where the cancer spread it. Indeed, we found out she had colon cancer. This colon cancer was terminal. Yes, she died on February 9, 2021. I tell you this story so that all women, young ladies, older ladies get examined. As well, this mainly targeted ladies from 50 years old and up. But it happens when you're younger as well. We need to and we have to pay attention to early signs of ovarian cancer, which are bloating, pain in the abdominal area, and the loss of appetite. Why? Because we are able to save ourselves from becoming a stage 3 or 4, which is something difficult to fight off, but not impossible. As well, the advanced signs are important, which are weight loss, bleeding in the vaginal area, as well pain while having intercourse. If you have these signs, attend them, go to a doctor, let them know what is happening, so you can have a pap smear and see if there's abnormal cells. This will help you and your family members, such as mothers, grandmothers, sisters, be aware if not, they have ovarian cancer. Hopefully our presentation informs every young lady and one day can save somebody's life, because it can happen to anyone. Thank you for watching our presentation and hopefully you enjoyed. Bye!